Okay, just to start things off, can you kind of take me through this digital inhaler and what it would do for patients?
Well, it's an inhaler that's available commercially, and I mean without the digital aspect. So it's available as a straightforward inhaler, but the digital one has a computer chip in it, which records information which is useful in interpreting whether somebody's using the device correctly, frequency of using it, and the biggest advantage of something like this is really based on two factors. That the majority of people who use inhaler devices for asthma or chronic obstructive pulmonary disease can't use the device correctly. A very large proportion of healthcare professionals also can't use devices correctly. And recent studies showed that there's been no change over 40 years. So we have a problem there, because if you're using a drug that needs to be inhaled and you're not using it correctly, the drug's not going to work. And secondly, this drug has what's called a short-acting beta agonist in it, a reliever drug, which opens up the air passages, which is used for both asthma and for COPD. Now, in asthma, excess use of albuterol or salbutamol, as we call it in Europe, could be risky. It could lead to problems in two ways. One, the drug isn't really an anti-inflammatory drug, so it's not going to work against the inflammatory process which is going on in asthma. In COPD, or chronic obstructive pulmonary disease, it's a reliever drug, so it's not so important in that disease with regard to risks of overusing a drug which isn't really going to address the underlying issue. So this device records frequency of use, and in asthma, certainly the more frequently you use albuterol, or frequent use of albuterol could signal a deterioration in lung function or an attack, an impending attack. And so the device records these details and gives the user a warning. You're using excess drug, contact your healthcare provider. But it gives another warning because it measures the speed at which somebody's inhaling, so the peak inspiratory flow, and also the volume of air that the person's inhaling. And the device gives feedback to the patient in the form of a signal via an app on a phone, an iPhone or an Android, which says there's a possible problem with your technique. And so you get those two signals. One, you're possibly in danger, and two, your technique is at fault. In both cases, the person would need to contact a healthcare provider and get some extra medical help. And so what the digital device offers is both the medication, but also an early warning system, as well as a system which informs the user whether they're not using the drug correctly or not, the device correctly or not. And so the other thing that the device does, or that the app does, is it produces a report which the patient could hand to their healthcare provider or send to their healthcare provider. So it's generating information that isn't available with a straightforward inhaler device.
Okay. Now, when you say there's been many patients using inhalers wrong for the last 40 years, is there kind of one way where everyone's using it wrong, or is there all different kinds of just problems we're having with inhalers?
Well, in Europe, we have 127 different inhaler drug combinations. So there's no one answer for all those drug device combinations. But in general, the press and breathe devices, the old-fashioned puffer, requires a person to inhale slowly. And if you inhale too quickly, the drug just gets stuck in the back of your throat and doesn't get into the lungs where it should get to. So that's the major problem with the press and breathe devices, is people don't breathe in at the right speed to allow the drug to get into their lungs. There are all sorts of problems with different inhalers. Some of them require to be vertical when loaded or when primed. If they're not vertical, the drug doesn't drop down into the chamber, which will then deliver the drug into the lungs when it's inhaled. Some of them require quite a lot of effort and speed of inhalation, because some of the drugs which are formulated in dry powder formulation are attached to carrier substances. And so the drug has to be released from those carrier substances, so-called deaggregation. So that requires a certain amount of force and effort. And depending on the inhaler device, the device characteristics, in particular, the internal resistance within the device, will determine how hard you need to breathe in order to deaggregate that drug. And then they've all got their peculiarities. Some of them are very easy to prime and load. Some of them a bit more complicated. You have a strip that you've got to tear off one of the devices. If you forget to tear the strip off the side, then the device clogs up and doesn't work properly. There are issues related to knowing when the drug is empty or not. Some of them have got counters on, some don't. Most have counters nowadays, but if a device doesn't have a counter, then it's very difficult for someone to know when it's running dry, when to order a new one. And so with a device that's automatically telling somebody via an app, you're running out, it's time to order another one, you've got that added advantage.